You're listening to 90.3 WHPC, the voice of Nassau Community College in Garden City, New York. I'm Bill McIntyre here with Jon Gallo for another edition of this week's Long Island News, the news show that brings you news stories about Long Island and about Long Islanders. All right, and coming up in about 30, we got such a jam-packed show. Coming up in about 30 minutes, we're going to have Dr. Cassiere from Northwell Health. But right now, we have with us, and we're very grateful to be joined by Nassau County Executive Laura Curran. How are you?
Gentlemen, I'm fine. Thank you. How are you doing?
We're doing well. Thanks for being with us. We hope you and your family have been having a good holiday season so far, and we appreciate you coming on to talk about some important topics, of course, with our listeners here to close the year.
Yeah, sure. Happy to.
Did you finish your Christmas shopping?
I did. I'm all set.
You did?
I believe that very much. You're definitely always prepared.
Oh my!
Yeah, I know. It's very anxiety producing. That's why I like to just get it done.
You know, it's so wild. I was in a clothing store the other night, and I think this is the worst situation in the world. I'm shopping for clothing for a woman. I said, that's horrible.
Really hard. Shopping for a woman, I think, is a lot easier than shopping for a man. A woman, you can get her jewelry, you can get her a lovely scarf,
this is true.
She can get a nice bag, and she's happy. Men, it's like they already have everything they need. Who needs another pair of cufflinks? Really, nobody.
Yeah, exactly. How many more
perspective is everything.
But that all said, we know certainly there's a lot still on your plate here to close the year. And we did want to start, of course, with this week's Long Island News, because we know you're still working hard for the people of the county here. So we've come to your attention, and our station director, is a parent out here on Long Island. And he seemed to, along with other folks I know, get a notice from NCPD kind of relating to some kind of online potential hoax or something that was going out there about concerns around an elevated risk of school shootings. So can you just tell our listeners, I know there was a lot of discussion and noise on social media about that, just put that into context, what happened there and, why people can feel comfortable that NCPD is doing everything to address any threats or any online hoaxes.
There is no credible threat. However, we are making sure that we are having extra patrols at the schools because of this ridiculous and completely irresponsible TikTok challenge. And I cannot stress enough, any of our young people who are listening, be really careful about what you share because, you could be held liable. If you're sharing, potentially dangerous information, you might get the police knocking on your door trying to find out what's going on. This is not to be taken lightly. I think it's a poison in our society right now. What the harmful effects of social media, you're seeing it right now. So now we have to reassign our police resources to places where things probably won't happen, taking them away from the other jobs that they have. And it is just, I think, I'm sorry, I hope I don't sound hyperbolic, but I think this is just getting out of control with this crazy nonsense on social media.
It's been. I think it's been. You make a good point, and I don't think that your warning is just for kids. I think it's for everybody on social media.
Parents reposting it too. I know I had one of our interns in our office, their mother was in a group chat, a week chat, I believe, with other particularly Asian American, a lot of immigrant parents, and they didn't know what to make of it. They don't know, is this a hoax? What do they do?
To be a little more specific, CBS News was reporting on this early this morning, and what they were saying was that it was a TikTok challenge to other TikTokers to create trouble at their schools once the school day was over. That was the original. Thing. There was nothing said about school shootings or any of that. That was put together because that seems to be our news topic all the time is somebody getting shot in school. But it was about kids poking each other to create trouble. And then it turned into, when it went viral, that's when, this could have been initially written in Oregon someplace. It had nothing to do with Nassau County or New York State.
That's exactly right. And now everyone's scrambling. And then the school, think about what the schools have to deal with. They've got to deal with panicked parents, people calling. Yep. They've got to coordinate with the police. It's hard enough right now with COVID and Omicron and, all the stresses on the educational system right now. It's not easy. This is not good.
Yeah.
There's just no other way to say it. There's nothing good about this.
Nope.
Bottom line. Let's focus on some good news in the sense that it related to policing, actually, that one of NCPD's own, the chief of detectives, who I believe that you appointed to that position, Kichint Sewell, was named the new NYPD commissioner by the incoming mayor, Mayor Adams. So can you talk a little bit more? I know you were quoted in the New York Times in favor of that choice, and can you just talk about why that's such a good decision and why it's a good thing for Nassau County, I guess, as well?
Yeah, I thought it was a very bold and very great decision on the part of Eric Adams, the mayor-elect of New York City. So, I've had a chance to work with Kichint to get to know her. She is a cop's cop. She has the respect of the detectives union, which is not always easy. She's the chief of detectives. But she has risen through the ranks on the merits. She was a patrol officer in a very busy precinct and then became a chief. Now she's a 3-star chief. And I have seen her in action. She has the experience and the skills to do the job, but she also, I believe, has the demeanor and the presence to do the job. She's got this great posture. She commands the room, but she's rooted in a kind of humility and, realness that I think will make her very effective in connecting with the rank and file and also in connecting with communities. Because remember, community plays a really big part in making sure the community is safe. The cops can't do everything. You've got to work with the community, and she brings that aspect as well.
Yeah.
She grew up in New York City. She gets the city. She understands it. And I've seen her, let's not forget, we had 300 protests, give or take, after George Floyd. And seeing her sort of in the eye of the storm in one of these protests that really could have just taken off and become incendiary, she commanded the situation. There were two sides that were against each other. She was able to get in the middle, talk to them both, and bring down the temperature. And I think it's that de-escalation, it's that groundedness that will serve her well in New York.
Yeah.
And the other thing I'll add is, Commissioner of Police in New York City is a challenging job no matter what. Right now, it's especially challenging. So there will be crises. Things will go wrong. It will be, there will be very difficult times. That's a given. The question is how do you handle it? And I think she will handle it with grace and aplomb and professionalism.
I agree with you. I saw her, I guess she was speaking to the press, and it was a fairly short clip on television, but that was my immediate reaction, is that her decorum and her professionalism, I right away, I said, you know what? This is great, because she really, she communicated to me. I understood exactly what she was saying, and I really felt that. I think she's going to do well. Again, you said it. Being the chief of the, commissioner of police department, what's that, 35,000 New York City cops?
Yep. And
in good times. Too. In good times. I personally, in good time, I wouldn't want that job because it's got to be big to start with. But add bad times to the top of that. But I feel good. I feel good about her and what she'll bring to the job.
She did also discuss something which I found pretty fascinating, and sometimes you don't hear as much, in the context of policing, emotional intelligence. She's, really kind of pounded that messaging on why that's so important. Like I said, not only to understand the needs of her membership, but of the community, knowing complex, kind of circumstances, of course, are at play. So you talk about maybe why you think that's a good trait for her, but not just for her in that position, but all maybe civil servants and electeds potentially.
It's really important. And I think now more than ever, when there is a feeling out there that things are, the world has changed so much because of COVID and the political climate right now. And I think to have someone who is emotionally grounded and emotionally mature is reassuring. I think that sends a very reassuring message to people that, you know what, all right, we got someone in charge who gets it, she understands it. Maybe I won't agree with everything she does, but at least I'll know it's coming from the right place, that the intention is good. Right. And unfortunately, the way civil discourse is right now, I think fewer and fewer people with those kinds of traits are attracted to it because it's so difficult and challenging, and who wants to be bothered. So anyone who has those kinds of qualities, I think we need to really raise up and recognize that, even when we don't agree with them.
Yeah, too bad we wouldn't vote for all of the people who just showed that. It's funny because when we've had Commissioner Ryder on, we always have that overriding thing where we talk about cooler heads prevailing. Cooler heads need to prevail. I think that she should be the poster child for cooler heads. That's what she reminded me of. Someone who
mediate volatile situations, like you said in that video.
Just very balanced on all of the avenues that she took information from and what she addressed. Emotional. Who addresses emotional intelligence? I can't say I've heard a lot of people say that. So just the fact that that's, wow, how refreshing.
But of course, someone will have to fill her position, right. And obviously she leaves Nassau County's department, which I know is certainly trying to always make gains in terms of diversity and in terms of leadership on this kind of community policing initiative. So can you talk about that, and then also the fact that we do have the new NCPD training center now fully operational, right over a stone throw from the radio station over here on our campus, and the new recruit class and graduates coming through. So can you just talk about that maybe briefly, how that all kind of plays maybe going forward into the new year?
Sure. So this police academy had been discussed for a very long time, and it just never happened. It could never get off the ground. So actually, when I was running for this job, I wanted to have a look at it. I looked at the plans. I talked to the folks at the police foundation and in the police department, and I said, we got to get this done. Let's just do it. So, fast forward, I win the election, and one of my first priorities was to get this done. And it was difficult. We had to get approval from the legislature. We had to get approval from NIFA. We had to get the financing ready. I have to give a huge thanks to the police foundation that really helped push this forward and helped fund a lot of it as well. But I made sure we got it in the capital plan, and, working with our labor unions, working through COVID. And I'm so proud of the fact that we got it done when people said, it's probably not going to happen, don't waste your time. We got it done. We are the 12th. We're now the 12th largest police department in the country, and we never really had a proper academy before. And it is state-of-the-art. It's right on the grounds of the community college, which is good news because it can work with the college. It will help, I am sure, with more diversity and recruitment, which is something that we're working on as well. And it gives, and not just our cops, but also our corrections officers, our deputy sheriffs, public safety, and other agencies that want to use it as well. We can make a few shekels there, which is not a bad thing. Use it as well for their training. And it's the latest technology. It's state of the art. It's beautiful, and it's right in the center of the county, so it's accessible.
Of course, and we look forward to doing a walking tour at some point in the future. I'm sure Bill and I. And I know, thankfully,
again, you should. You'll be impressed. You'll be really impressed.
Oh no, yeah, and I've been impressed by the fact that the department has been very open to the public in terms of seeing what all, like I said, went into it, and what hopefully is gained from this investment in our future basically here.
Right.
So
right, and the fact that it's got that. It's got the gym in there. It's open for the community, for the kids to come, and whatever. It's a very open place, which I think it should be.
Exactly. So, okay, and then just the last, topical news, maybe point primarily that we just want to kind of bring up and mention, and we're going to talk more about this with the director of critical care services over at Northwell Health, North Shore University in a little while. But in terms of COVID, we know vaccination rates thankfully are still very high. Obviously the county's done a great job in pushing that out and making folks have the option to get the vaccines and the boosters everywhere they can. And the COVID rates are a little bit higher, but they are relatively stable. So can you just talk about kind of where you see that at the moment? And I guess that does kind of take us into the fact of going into the transition. I see that the Department of Health's Dr. Larry is, I believe, part of the incoming executive's transition team. So can you maybe just say how maybe listeners might feel comfortable knowing again that that's the case basically, and what you guys have done to put us in a good position going forward? Yeah.
Yes. Well, this Omicron variant is, as you I'm sure have been reporting and reading, is incredibly contagious. And you can be triple vaccinated and still get it. Luckily, when you're vaccinated, it's very mild. That's what we're seeing by and large. And so while the cases really are popping, I will be frank with you, these cases are popping. Hospitalizations have remained stable. Anyone with COVID in ICU has not been vaccinated. So most of the folks, the majority of the people in the hospital, not ICU, but everything combined, are unvaccinated. So that's proof that the vaccine really does work. I mean, there's just empirical proof right there. But there's a lot of uncertainty right now about where this is going to go. So, like always, we're asking people to take a personal risk assessment, to be careful, because we've had some schools shut down now, going remote for a few days.
Right.
So, I think, unfortunately, I'm so sad about this because the last thing we need is more uncertainty. life needs to be as normal as possible. And this, Omicron is making it challenging. A lot of folks were ready to bring people back into the workplace in January.
Yes.
Now a lot of those plans are being postponed again. And we've got to find a way to live with this. We've got to find a way to live with this and not have it completely turn society upside down again.
Yeah.
Of course.
Yeah.
And, to that point, like I said, let's remind our listeners they are listening to this week's Long Island News here on 90.3 WHPC, the radio voice of Nassau Community College, with Bill McIntyre, myself, Jon Gallo, and thankfully still joined by Nassau County Executive Laura Curran. To the fact that, like I said, that, I know you're into the transition period now, and, it's been reported that, the incoming executive Blakeman has said that your administration has been very professional and helpful throughout this transition. What about, again, that role that Dr. Larry is going to be playing? I don't know if he's staying with them, into the new year fully or just part of the transition, but, why is it important to have those kind of institutional people in place during these kind of, complicated times, I guess?
The government has to continue. We have to make sure that the transition happens smoothly because it's not about us as people. It's about the people that we represent. So, I take that very seriously. I got into this because I wanted to make things better, and I want to continue to do that in whatever my next capacity is. And through this transition, I've instructed my staff to make it smooth, make sure they have the information they need. And there's a lot that goes into running Nassau County. It's 7,500 employees. It's a $3.3 billion budget. We've got the health department. We're in charge of public safety. The sewage has to work. The roads have to keep getting paved. I mean, these are really important functions. And the smoother they continue, the better it is for everyone. I live here. I will continue to live here. And I need this in raising my children here in Nassau County, and I need this place to succeed.
Mm.
Yeah, of course.
Wow.
That makes plenty of sense, and that's what we all hope, definitely continues from, what you and your team, kind of put in place, like I said, some of those institutional kind of policies and changes. Bill, I know you had some other thoughts as well.
I mean, let's go back. I was going to ask you, Laura, what happened with the election?
Yeah, it was a tough night, obviously. for them.
I lost. What makes it okay? What makes me, it's a bittersweet feeling. It almost feels like a breakup. But what makes it a little more sweet than bitter is, number one, I really have no regrets. And number two, I lost by less than 1% when the other Democrats who were running countywide lost by about 20%.
Right.
So clearly I had a lot of support. The Democrats, their turnout was much lower than the Republicans. It's almost like Democrats need Donald Trump in the White House to feel like their vote matters. I'm not sure what that's about.
Yeah.
It's like they need the guy more than the Republicans do.
Yeah.
It's like people need to be angry, especially in an off year when there's not a presidential year happening. People almost need to be like either angry or afraid to feel like their vote matters. And there's complacency, and who knows? I don't know. I feel like I campaigned as hard as I could. I was everywhere, but at the end of the day, people made their decision one way or the other, and what could I do? I just have to accept it.
It's funny because I've got to say that I looked, just going through the paper and doing some of the research that we do here, for stories and things, and just to look at the vote turnout in one of the elections. I mean, somebody won, and their total vote count was about 4,000 votes. And I thought,
isn't that something?
Yeah. Well, it seemed almost as though, listen, when you're in charge of the county and you're the one that's spearheading, a tax thing or this thing, you're always going to take the junk for whoever doesn't like it.
Of course.
But I think
Which
it was
is fine.
Yeah, right. I mean, you're the captain of the ship. If it goes down, they're going to ask you what happened. Okay,
right.
We get that. But it seemed to me, just looking at those vote counts, that people might have been angry. Okay, so they're not angry enough to actually go out and vote for your opponent, to get you back, so to speak. But they may have been angry enough to just not go out and vote at all.
Right.
And that's what it looked like to me. It was.
That could be it as well.
because nobody's happy with. See, my thing is, and I would ask this question to every politician: are Long Islanders out of their minds to think that their taxes will ever go down?
I know.
Because
I know, and I feel like I would say till I was blue in the face. Well, actually, I have not raised taxes. In fact, I've been able to reduce taxes for next year. And look at your tax bill.
No, they're still mad about
how
them.
much.
Right.
What percentage is your county taxes? It's a very small percentage.
Oh.
That's all I'm saying.
Yeah.
Right. You know?
And the matter of public.
Right. Sadly, most are not looking at the breakdown. They're looking at the total.
Yeah.
No, and it's a lot of the narratives, and knowing that public safety was obviously a crucial issue that the Republicans certainly made the most of in the talking points around bail reform. But meanwhile, of course, we've spoken with you and with the commissioner about how Nassau County continually, year over year, is rated the safest county of its size in the country. So there seems sometimes to be a disconnect, even with what the data on the ground is and what the kind of overarching political narratives can be at times. I guess
it's called rhetoric, and yeah.
Spin, a lot of the terms for it, of course. But nonetheless, like you said, it is kind of the outcome here. And, I guess, in terms of, what about, not just Senator Kaminsky and the rest of the ticket, which I know you've had some interest, comments, that you said on other airwaves, regards to what you think, that kind of played. But what about the party? People I know have somewhat criticized, Jay Jacobs for maybe, kind of trying to not get so involved in some of the things like the ballot initiatives, which I know the Conservative Party and, other folks kind of rallied around and might have inflated some of their turnout. What were your thoughts, just, I guess, overall, I guess, a little bit kind of post-mortem, I guess, to say on that front?
Yeah, I think it's tough, for the party chair when the loss is small like that, when it's 2,150 votes, because you could say it was this, you could say it was that, and frankly, you would be right.
Yeah, right.
If it was
a
this,
correlation,
not
just direct
right
causation, though.
Yeah.
And it's a tough position to be in because when people win, you're the hero. When people lose, you're the villain. And sometimes there are things that are beyond your control, where there's some decisions that were made, sure, but what are you going to do? That's life. It's politics. And I'm not here to demonize anyone. I'm very good friends with Jay. I'm fond of him. I like him. And these things happen. What are you going to do? What you can do? You can learn from it. What went wrong? What did we do? How can we do better next time?
Yeah.
And I think that's
exactly
that's the approach I'm taking.
And sadly, that's a fact of life. We only learn from our mistakes. We don't learn from when we do it right. Yeah.
Exactly. We're only so good because of our mistakes.
Yeah. Well, anybody that's really, really good at something, you have to safely assume they've made a lot of mistakes because they learned how to do it right. I'm curious.
It's all experience, and wisdom. Go ahead, Bill.
What's in your future? What are you looking at?
Well, you probably know that I have a background in journalism. I was at the Daily News. I was at the New York Post. So, and in this my job as an elected official, I've had the chance to do a lot of radio, which I love, and television and media. So I'm looking forward to getting back into that field. Sort of synthesizing the two, taking what I've learned in public service, knowing how the sausage is made, and then, using and going back to sort of my media and reporting skills and doing something there. So that's what I'm exploring. Nothing, I'm going to take my time. I'm not rushing into anything, but that's something that I'm exploring.
John, I think we're talking to our competition now.
Oh boy! I don't know if we're gonna get any more exclusives going forward, but definitely look forward to seeing you maybe on the press lines out there or in the pool maybe again. But in whatever capacity, I know certainly, like you said, you have an invaluable expertise, having not just been on the press side and then in comms, but actually as the principal, the elected yourself. I'm sure people will stay tuned and certainly be interested in what that all entails going forward. Imagine maybe some more time, hopefully, for the family too, and some Islanders games.
And Islanders games. Yep.
Stay the whole.
Now that they're winning at home, it's a beautiful thing.
Yep. Oh no, it's a beautiful building. It took a little while for us to get that win, but it was certainly all the sweeter when it came.
I know, but we got it, which is good.
Yep, exactly. Nonetheless, so I know we only have a few more moments, and it's good to know, like you said, that you already have a good amount planned going forward, and obviously you still have to finish this year. Like I said, holiday events, still important matters at hand. But maybe just in the last moment or two we still have with you here right now in this capacity, county executive. What would you say maybe are some of just the proudest accomplishments, I guess, that you've had in office, and maybe some of the main lessons you could give to listeners, especially maybe young listeners, who saw you in your position as potentially inspirational?
Well, I am very proud of the fact that we kept Nassau County safe, safest community in America for 2 years in a row. I'm very proud of our leadership through COVID. I'm so proud of all of our employees that really jumped in to take care of people, keeping people safe. I know that our work and the information that we got out there, and whether it was testing and vaccination or whatever it was, I know that we saved lives. I'm incredibly proud of that. Proud of the fact that I fulfilled some campaign promises to do things that might not be popular, like reassessment, getting the finances in order. We've left this county in such better financial shape than we found it, and that that will benefit my successor. And I'm proud of the fact that I've never put my name on the sign. I still get feedback to this day from people. Like, people will say, I don't really like you that much, but I love that you did that. Yeah. Good for you. We need more of that. Mm-hmm. So I think I set a new tone for Nassau County. We had Newsday said that there was no scandal in my administration, which I'm proud of. That's an unusual thing for Nassau County. And as you know, I didn't make a big deal about gender, about being the first female, but I think young women can learn from this and go places, go into that old boys club and make your mark. You can do it. You just gotta put the effort and the work in. And that makes me very happy. You know what?
It's very cool. Cool that you mentioned that, because just the fact that you never made a point of it, but conversely, no one else ever made a point of it either. Which I think reflects on how you dealt with the things you had to deal with.
Yeah, it's true. Yeah, it was never. I never felt like the gender thing was a problem or an issue, or it was never used against me.
No, right. It never melted down to a point where somebody said, "Oh well, she's a woman."
Tokenism.
It never happened.
You never heard that.
Yeah,
it's all about the person and the skill, like you said, the meritocracy aspects of it. But I think that's certainly great advice. For any young students who might be listening, anyone young at heart, maybe some young journalists in the future, making so certainly
us. But listen, we just want to make sure that we'll probably call you, to get your take on certain things that are happening.
Sure,
seeing as how you've been in the cauldron up to your neck at times, and some of the things you got. Again, the job is hard when nothing is out of place. But there were a lot of things that happened during your administration that you fielded.
Yeah, it was action-packed.
Yeah, you fielded very well. So, a good soldier. You took the hits, and you came out on the other side. You survived it. You made it, and you left the place better than when you entered.
Yeah, thank you. And that was always my goal. No matter how long I was here, I wanted to leave it better than I found it. And I thank you for that.
Yeah, you definitely did.
Yeah, we appreciate that. And again, we appreciate your time, over the last few years here, and all the time you've given, and all the assistance and collaboration with the college here, of course, and with everyone involved, around the county and around where we live, of course. So just thank you again for that, and we certainly look forward to speaking with you in the future, and wish you well in all future endeavors. And happy holidays.
Have a great Christmas.
Thank you, gentlemen.
Happy New
Merry
Year.
Christmas. Happy holidays.
We hope to speak to you soon.
And I wish, call me. I will come on. I wish you all the best, and I wish all the best to our wonderful community college as well. God bless.
There you go. Thank you very much.
Amen.
Take care.
Thank you so much. Take care. Be well.
Okay. Bye-bye.
And now, we're very happy to be joined again by Dr. Hugh Cassiere, who is the Director of Critical Care Services at Northwell Health's North Shore University, Sandra Atlas Bass Heart Hospital, and he has a background in pulmonary and internal medicine. Well, hello again, Doctor.
Good morning, guys. Great to be on again.
Oh, yeah, it was great. We really enjoyed you last time, and I hope we, get some more good information like we did then.
Yeah.
Now,
appreciate
obviously,
your time, of course.
Yeah,
absolutely.
A lot of people are concerned, and we're talking about the Omicron variant, and it's only been a little while since we spoke to you, and I'm confused again. So, you know what I mean?
Yeah, I could understand that. Even we do this, it's my profession. It's really hard to follow.
Right. And I think, but that's a good lesson all in itself for our listeners, too. Science changes from day to day. So an answer you got on Monday may not remain true by Thursday.
Yeah, good point. Science changes during this pandemic, science changes by the week.
Right.
As we accumulate data, and that's not a negative, that's actually a positive. So
exactly.
I'm glad you highlighted that, because there's a lot of controversy, and I'm a physician scientist.
Right.
So you have to follow the data and the science you have at the moment. Sometimes make predictions, sometimes they're right, sometimes they're not. But that's the best we can do as humans with the data that we have.
Yeah, and it's a difficult situation because of the atmosphere that we're in. We have a doctor that answers A on Monday, and then by Wednesday he's saying, "Oh no, actually it's B," and you have people calling into question, his 18 degrees and background and professionalism, because there's two different answers from Monday to Wednesday.
And they saw something on Facebook that contradicts both somehow.
Right. My uncle said, great, okay. So we're coming right to the source then, and that's you. I have one beef with media in general is, and you can tell me if I'm right, I could be wrong.
Sure.
They keep printing the percentage. Okay, we know that more people, I guess, are getting infected. But that, to me, at this point in time, seems to be more a scare tactic than useful information. I understand people are getting infected and we need to, but I think they should be telling us how many people are actually passing away from this and who they are. Are they inoculated? Are they not? What do you think?
Yeah, so good. I am, again, I'll repeat this. I'm a physician scientist. I'm apolitical. Especially when it comes to this type of information, and it's true in the sense that typically before this pandemic started, the number of cases predicted the number of hospitalizations and deaths. That's not necessarily true. So I think our media partners are just kind of following the typical playbook, because it was in the past in 2020. The number of infections went along with hospitalizations and death. That there's a disconnect with that now, and I think they're trying to play catch up. We're very sophisticated, so we pick up on that. Right. And when we start talking about the Omicron variant, that's a great example of the increased number of cases do not necessarily translate into hospitalizations and deaths.
Right.
So yes, I think they're obligated to report the number of cases, but now we have to look back over, now it's going to be a year and a half, coming on 2 years of data to try to help predict, does it really also correlate with deaths and hospitalizations? And that's not true any longer.
Right.
So I agree and I disagree.
Okay, so that's a good point, and we appreciate that context, Doctor.
Yeah.
So, from your experience being, on the front lines, being in specifically the pulmonology specialty field there, seeing, these things firsthand, what can you say, though, may be different if you've seen already the Omicron variant in terms of how it manifests? Again, like you alluded to, some say it might be more infectious, but that doesn't necessarily mean it's more deadly. It might be potentially less. So what are you seeing, if anything, from patients coming into the hospital system?
Yeah, so I'm glad you said that. So right now we have, we're up about 40% hospitalizations across the health system. In my particular hospital as well. We have a slight increase in the ICU patients in the ICU. None have been identified as Omicron yet. I want to kind of highlight that for your listeners. What we're seeing now, this is old-fashioned Delta.
Okay.
We're still in the Delta phase. Soon, maybe converting to the Omicron phase. So a lot of what I'm going to tell you is really based upon we're dealing with the Delta surge.
Now, I did hear this morning on the way in here, actually,
CBS
News reported that 38 states have now seen the Omicron.
Yeah, it's probably been here. It's probably been here before we realized it. And again, you guys are sophisticated. Probably the first case of Omicron came from the anime convention in New York City back in the beginning, right before Thanksgiving, and then that gentleman flew back to Minnesota, and that's when the Omicron kind of went all over the place, and we got the hype about that.
Right.
But a lot of what I'm going to tell you is based upon South Africa. still, because that's where, over 90% of the COVID-19 infections in South Africa are Omicron variant. And what are we seeing? And again, you guys follow the news. I'll just kind of reiterate that.
Wow.
It seems to be much more highly infectious than the Delta variant. So their infections are way off the chart. But interestingly, their hospitalizations are down by almost 30% compared to last year. And the death rate is very, very low. So that's interesting data. Now, I had the chance to review some information you guys probably heard on the news. There was a study that's probably going to come out soon that looked at a bronchial tissue and lung tissue.
Oh, boy.
And the reason why I differentiate, the bronchus is the tissue in the upper airway. The lung tissue is the tissue in the lower airway. So what this particular data shows, the Omicron variant has an infectivity rate 70 times greater than the Delta. Let me repeat that.
Wow, yeah.
The Delta variant, which is a highly infectious virus, this virus puts it to shame. 70 times the infectivity and replication rate in the bronchus. That scares the hell out of me. But let's talk about
if we
what
paraphrase
does it do in the lung tissue. In the lung tissue, deep down, it's 10 times less likely to infect the lung tissue and replicate. So the reason why I mentioned that, this data that hopefully will come out soon is telling us, okay, it's highly infectious, right? It infects your bronchus and it could spread all over the place. But in the lung tissue, where pneumonia develops, where you would expect a severe disease to happen, it's less infectivity. So it's kind of matching what we're seeing in South Africa, and hopefully that's going to hold true. Yes, it's highly infectious, but hopefully Omicron is going to turn out to not really translate into hospitalizations and death, I hope.
Right.
Yeah.
And the other thing is that this is, it may explain why this Omicron variant is blowing through the vaccinated population, is that it's just so highly infectious that even with adequate antibodies and vaccination, you could get infected from it. But again, less severity. Now, I went over a lot of stuff, but I just want to kind of highlight that for you guys. Yeah. We're seeing a Delta surge still. Omicron's coming in. And so far, based upon the South African data and some of this data that I shared with you, it is highly infectious, but hopefully it's going to translate into not as many hospitalizations and death. And we're praying for that. But this is where the science is and predicting, trying to make a prediction based upon it.
Well, to paraphrase that, I mean, 70 times more infectious. Does that translate to we're all probably going to get this?
Well, yeah. Well, again, this model is what we call an ex vivo. What the hell does that mean? It means it was done outside. It was done on tissue outside the body.
Oh, okay.
Oh, you got to be really careful, because what this study didn't show is what's my response to that. Now, maybe even though it's 10 times less likely to infect lung tissue, maybe there's just enough to cause, that cytokine storm and inflammation.
Yes.
I'm hoping it doesn't, because what we're hearing out of South Africa is it really doesn't seem to be such a severe disease. So I'm hoping, this study is going to kind of bolster the fact that Omicron, yes, it's infectious, but less deadly.
Okay. So, and then to that point, knowing that a lot of discussion has been about getting the vaccine kind of distribution chain figured out, getting the vaccination rates up, what are we seeing in terms of the data? Again, this is novel, new variant, but now there's been a little time since that's been out in the public, and I know researchers are looking into what the vaccines do in terms of mitigation. Is there any hard data yet? What are you hearing, you and your colleagues, I guess, that looks solid in terms of what people can expect?
Yes, I think it's becoming pretty clear that the Omicron is not Delta and not the previous variants in terms of having that nice 90% protection with the mRNA vaccines.
Right.
Yep.
You're probably down to maybe in the 30%.
Really?
Now, that sounds horrible, but let me pull back and step back. But the likelihood that you will develop a severe infection is still in the high 80%. So let's talk about what is really the concept between vaccinations. The concept between vaccinations is not to stop you from getting infected. It's to stop you from getting hospitalized and dying. So the messenger RNA vaccines still do that, even I think with the Omicron variants. That's really important. And it's really important to, in the context of hearing all this controversy going on with the anti-vaxxers, why should I get vaccinated if I'm still going to get infected? Yeah, you could probably still get infected if you're vaccinated, but you ain't going to die. And I think that's a really, really important thing to highlight. The vaccines were not developed to prevent you from getting infected. It's to prevent you from overwhelming the hospital system, the healthcare system, and dying and infecting others.
Yeah, this is not a complex concept to grasp. You don't need a doctorate degree to understand it. But why should I get the vaccine? I'm still going to get infected. Okay, but you're not going to die.
It wasn't going to stop that in the first place. So, I'm curious, though, is there with this new report, will there be a breakdown as to how it affects children as opposed to adults? I'm getting some anecdotal evidence that kids are starting to have more of a reaction to this than during the original. Initially when it all started, the sound bite out there was, it doesn't affect the kids. Okay.
I think that's a really good question. And I don't think we have really anything. I don't even have anecdotal data to go with you. I can infer, if we infer, if you have a virus that's has a higher rate of infectivity, you're going to infect more people. You'll see more things. Maybe more kids, maybe more multi-system inflammatory syndrome, maybe more myocarditis, but it's not because of the virus itself. It's because it's affecting more people.
Right.
And so that's why it's really going to be. That's a really hard question to answer. I can't even give you a good answer.
Okay, well, it's just a reminder that you're remind our studio audience or our audience that they're listening to 90.3 WHPC, the voice of Nassau Community College, and we are talking with Dr. Hugh Cassiere from Northwell Health. I just had to remind them. We'll get into a conversation. We could go for a couple hours, I think.
We can go forever with this
one. I keep thinking of
Of course. So, but definitely, again, your perspective is invaluable when it comes to this topic. Another thing that obviously is being discussed, because it is somewhat the old playbook, but it is the playbook that we have. And without that, what do we use? But in terms of this mask mandate that's temporarily been put in place by the governor, Kathy Hochul, for the state, going to run until about the 15th of next month because, like we said, infection rates have been rising. Maybe a little less so on Long Island than they have in other parts of the state, especially out in Western New York and some of the other counties. I did actually hear that some of your colleagues from Northwell are actually heading to Western New York to, I guess, lend some support, kind of like the way they did to New York City during the peak of the pandemic here. So all that said, I guess my thought is, what exactly, can be done, and does the mask mandate, from your perspective, medically, not politically, make some sense potentially?
Yeah, again, I got to put my scientist hat on again. This is way overdue, guys. Wow, this is way overdue. This was predictable. I think we should have had a mask mandate 8 weeks ago. Again, and the reason why I'm putting that in perspective, we're at the time where vaccinations are waning and we're encouraging booster doses, which we need to do more of. We're at a time period where there's going to be more social gathering. I think this was clearly predictable that we needed to do something stronger than just say, I think you should wear your mask. I think we should have been encouraging masks all along and really adhering to it. And that's also, this is going to be a very unpopular comment I'm going to make. But again, I follow the science. I think there should have been stricter indoor dining, gatherings. I'm a strong proponent to that because you cannot take care of this pandemic with just one way of doing things. And thinking vaccination is the only way out is a fool's endeavor.
Right.
You need to be masked, no social gatherings. We don't want, again, I'm sick and tired of it as well. But this clear spike was predictable. And again, I'm not supporting anything other than this should have been done 8 weeks ago.
Yeah.
Understood. And I should clarify, too, that this mandate does have the option to either enforce a mask mandate indoors or, if not, to comply with mandatory vaccination proof kind of checks, basically at the door. So,
well, Sean and I were talking about it before, and the idea that we had at one time when this started. Remember, New York was the epicenter. Everybody was watching us to see what was going to happen. We had 800 deaths a day, and that went on for quite a while. How did we stop that? It was masks, because there was no vaccine yet. And we had already started bringing those numbers down. To me, this is simple. If I sneeze and I have something blocking my sneeze, chances are fewer people are going to be the recipient of whatever I may be spewing when I sneeze. It's pretty simple. It's a shame that politics got into this, because I would much rather
and I'm glad you mentioned that. This was a complete political hot potato to announce maybe 8 weeks ago to do a mask mandate. There probably would have been riots. And again, I'm taking all politics out of this. I am into liberties. I don't believe people should be forced to anything. But you have to step back and say, this is going to be going on 2 years of this pandemic. And we need to kind of be really savvy, and sometimes making the tough decisions. They are not going to be popular, for sure. So I'm glad there's a mask mandate now. But again, not to keep beating the thing up, but it's long overdue.
We had I know it's an ice cream outlet. I forgot the name of it, out in Medford on Long Island. The man actually closed his dining room. It was Dairy Queen. Okay, thank you. In Medford, he closed the dining room because people who made such a ruckus about having to wear a mask, actually the wait staff was in tears. So he just said, I'm not doing it anymore. Come to the window. So they were serving ice cream through the... Imagine that. Thank God this isn't polio. Thank God this is not polio, because I think this is going to last for a long, long time because of the damn politics.
Actually, I'm glad you said that. So this is going to be endemic.
Bingo.
COVID-19 is going to be around forever. It's just the question of how bad it's going to be and how we deal with it moving forward. And I hate to sound like a doom and gloomer, but we're going into 2022. I don't think any of us on this call right now would have thought we'd be talking about this now.
Right.
And I think we're going to be talking about it for a while.
Yeah. Like a lot of other, public health issues, whether they be the HIV, AIDS, epidemic that's still with us. Things can be managed and things can be, thankfully, made improvements on in terms of the care and, the expectations for those with diagnoses. So maybe that'll segue into that conversation, because I know you've been kind of on the cutting edge in terms of trying to use different methods of intervention. I know you with the BiPAP machines earlier when the pandemic was at its peak, and I know you and your colleagues are always looking for new ways to improve outcomes for patients. So can you talk about what you're hearing in terms of maybe new therapeutics, drugs and stuff coming to the market, how that might play a role as well?
Yeah, great. I mean, it's a hot topic, right? You guys have heard in the news about Merck and Pfizer coming out with antiviral therapies.
Right.
God, we need this. And they're pretty impressive. So, the Merck one, and hopefully they're going to get emergency use authorization. So the concept between both these pills, and it's a science lecture. I don't want to give you a science lecture, but the bottom line is...
I'm up.
Just the abstract, maybe.
These pills stop viral replication.
Whoa.
And it's pretty potent. And if you look at, and again, this data is preliminary, but it still looks really good. Significant decrease in hospitalizations and deaths when you take these pills, and they're 5-day course pills. And it's almost like, and you guys know what Tamiflu is?
Mm-hmm.
Yeah.
Tamiflu for the influenza, except this works even better. So imagine you think you have COVID, and you get tested and you're positive. I'm going to give you a script. You take these pills, you stay out of the hospital, and you feel better. Wow.
That's a great outcome.
That's not amazing.
Sounds like a win-win.
Right?
Yeah.
And if you believe some of the, and again, you always, whenever you get data from a drug company, you always have to look at it to be suspect.
Grain of salt.
But even if half their claims are correct, it's really a game changer. When we talked about vaccines, they're a game changer. when we talked about dexamethasone for the treatment of severe and life-threatening COVID, game changer. IV monoclonal antibodies, game changer.
Right.
This is in that camp. So hopefully we're going to have more therapeutics that I can prescribe to you as an outpatient. You don't have to come into the hospital. Isn't that great? Right?
Yeah.
So right now to get monoclonal antibodies, you got to go somewhere to get it.
Right.
To get dexamethasone, you got to be sick. I'm sorry to say that. This is something I can prescribe as an outpatient.
Well, you also have to be able to afford it.
Well, I'm hoping, again, drug companies are smart. They want to stay in business. I'm hoping they're going to realize that, not that they're going to, they realize COVID-19 is going to be endemic. This is going to be a market for them for decades. So, the best way to approach that is to help in the front like they did with the vaccines. We didn't really have to pay much for the vaccine.
Right.
I mean, personally, as taxpayers, we will.
Right.
But that's spread across the country.
But that's to our benefit too. So, yeah.
Yeah. So hopefully the Food and Drug Administration will kind of fast track these, and we'll get emergency use authorization. So that's really exciting. There's another drug that I'm kind of interested in. It's actually an antidepressant. It's called fluvoxamine. Luvox is the trade name, and it's a antidepressant used for obsessive compulsive disorder.
Whoa!
Now, what's really interesting about this antidepressant, it's found to have anti-inflammatory properties.
Whoa!
And there's 2 randomized controlled trials looking at this that show it has really good efficacy to decrease hospitalizations and severity of disease. Now, the FDA and the CDC haven't sanctioned it to be treated for COVID-19, but I'm really taking a good look at this and trying to see, advising my health system that we should maybe get a stockpile of this just in case.
It couldn't hurt, right? Couldn't hurt.
Yeah. And this drug, this antidepressant's been around for, I think it's been around for over 25 years. So it's, something we have safety data on. So
that's important.
So from our last, from besides the BiPAP, the dexamethasone, IV monoclonal antibodies, and the vaccines, the Merck and Pfizer thing looked great. And this antidepressant, which has been on the market for 25 years, also kind of looks promising. So there's some kind of hope on the horizon. But nothing's better than prevention, guys, right? Yeah. We know that, right? Prevention, get the vaccine, don't get infected, and let's go, let's move on.
Yeah.
Avoid the problem to begin with, so you don't have to worry about, like I said, trying to mitigate the actual effects of it. So, okay, let's just remind our listeners one more time that they are listening to this week's Long Island News here on 90.3 WHPC, the radio voice of Nassau Community College. And we're still thankfully joined here for a few more moments by Northwell Health's Dr. Hugh Cassiere, again, the director of the critical care services at Northwell Health's North Shore University, Sandra Atlas Bass Heart Hospital.
Yeah, there was another medicine, that I had recently read about, but it was more, I think, targeted toward MRSA, or those kinds of infections, flesh-eating bacteria and those infections that they don't have anything for now. They were. I wish I could say. I probably couldn't say the name of it even if I had it in front of me.
Neither could I. Probably. I gotta translate these things.
Yeah. But that was interesting too, and it's it's nice to know. The other new medical thing that I read about is the eye drops that they came out with that supposedly can make your vision like 20/20 for a day.
Well, listen, man, you got to email me that. I need it.
Okay. Yeah, me too.
That one sounds like a hot stock tip if that's the case. I don't know about that one.
Although, listen now, a pair of glasses you buy once and you use for a certain amount of time, this you're going to have to buy drops every day. So.
I'll take that, buddy. No problem with that.
Yeah, better than poking yourself in the eye with the contacts, of course, right?
Yeah, that's true too, yeah.
Okay, so, but just again, in those few moments that we have left, I did want to maybe touch on one or two other quick things. We did see yesterday there was an announcement in regards to one of the vaccines, the J&J, in regards to some of the discussion we had previously about concerns, I believe, with clotting. Can you just kind of make some sense, encapsulate what maybe was kind of the outcome of that kind of research, I guess?
Let's in these last final moments, we need to talk about the J&J and we need to talk about myocarditis from the vaccines because it's hot on the topic. So let's talk about J&J first. Mm-hmm. Way back when we had this conversation, J&J had good vaccine efficacy, not as good as the messenger RNA. But the recommendation was just get vaccinated because any vaccine helps. J&J seems to, it's going to be less favored now. So if you have an option of getting a vaccine, get the messenger RNA vaccines, whether it's Moderna or Pfizer, just from an efficacy standpoint, especially with this Delta surge and the Omicron variant on the horizon.
Yeah.
Flip side is, again, like everything, science, right? We got to go by the data. Early on, it looked like J&J was associated with blood clots, and it looks like it's probably more significant than we first thought. But that's just science. Now, when I say more significant, I don't want people to think that it's off the chart. It just seems to be a much higher rate than we had first thought. But still, it still is a vaccine that helped and saved lives. So the CDC and the FDA now, they made that comment. If you're going to get a vaccine now, please use the messenger RNA vaccines, not J&J. And I'm happy they did that. That's the first thing.
Right.
The second thing I'd like to talk about is there's a lot of news going around about the myocarditis people can get from vaccinations. And this has been a big in the armamentarium of the anti-vaxxers. I just want to highlight that. And it is true. Moderna has a higher incidence of myocarditis with the vaccinations, less than Pfizer. But I want to highlight that risk is about 0.004%. If you get COVID-19, the infection, your risk of myocarditis is 10 times higher.
Right.
So even though the vaccine can cause myocarditis, you're 10 times more likely to get myocarditis from getting COVID-19. So the bottom line is, please still get vaccinated.
Yeah.
And again, if you want to, and again, we're all worried about the myocarditis. If you're a male under the age of 40, you're at risk for getting myocarditis, especially from the Moderna vaccine. So we got to be careful about that. And I'm sure the CDC and the FDA will have some more guidance in a couple of weeks on that. And that's all I really wanted to cover with the vaccine.
Right.
Of course. And thank you again. That's invaluable information. And of course, as always, we need to tell people to have these conversations and consultations with their primary care physicians and the medical experts that they know directly, and have that personal connection to of their care. But certainly, again, knowing that everything that you see, you and your colleagues, being the premier, one of the premier health systems out here on Long Island and the whole region, certainly, again, we thank you, for that invaluable information, and we wish you and all your colleagues well during this holiday season and into the new year, because we want to see people make life easier for themselves and for you and your teams if possible. So thank you again. Dr. Cassiere, really appreciate your time.
Yeah, thank you enough.
You guys have a good holiday and happy New Year.
And next time we talk, let's just hope this is not the topic.
Let's talk about those eye drops with the vision.
Yes.
I'm ready for that.
Sounds good. Yeah, get that email
definitely.
ready.
We'll see.
We'll look forward to talking to you in the new year.
Thank you.
So take
Thank
care
you
either
so
way.
much.
Take care. Thank you.
All right. Well, John, a lot of good information on today's show. We touched everything, but just realizing that next week is Christmas Eve.
Yeah, wow. Calendar has moved fast. We're into another year already. Still somewhat hybrid, somewhat in studio, but nonetheless, just happy to keep moving through time here.
All right, and coming up in about 30, we got such a jam-packed show. Coming up in about 30 minutes, we're going to have Dr. Cassiere from Northwell Health. But right now, we have with us, and we're very grateful to be joined by Nassau County Executive Laura Curran. Laura, welcome to the show. Got in front of a TV set and said, "Go away, tell me when it's good again."
And now he's telling you to shut up.
He does that too a lot.
Sounds about right.
We hope to see you next time, Fridays at 3 on 90.3 WHPC.